So let me do this here. Welcome attendees. On behalf of myself, Dr. Hughes, and Dr. Amelie Ramirez, who could not join us today but wishes she could, I want to welcome you all to this webinar. Very excited to have the focus of this on the role of community-based participatory research in reducing health disparities, challenges, and opportunities. A few housekeeping items to keep in mind. Everyone, including myself, will be muted. You can write in a question in the box at any time, and Stacy, organizer, will announce the questions after the presentation. At the end of the webinar, you will receive a survey by email. Please complete the survey so we can get feedback and ways to improve these webinars. We also would like to hear suggestions on topics you would be interested in learning more about. I want to introduce Dr. Rena Pasick, a very esteemed colleague, Minority Training Program and Cancer Control Research Director, Organizer, Creator, and MTPCCR. And she will introduce our speaker today, Dr. Lourdes Bascondi. I hope I said that right, Lourdes. Rena, it's all yours.
I can say it. I've practiced for many years. I've practiced, so I'm ready. Hello, everyone. Thank you, Danny. We've had a lot of wonderful webinars over the years through Exito, and this is one that excites me the most and was kind of the hardest to organize as well, because Dr. Lourdes Bascondi Garbinati is a very busy person. Everybody wants and needs a piece of her wisdom and her insight and her experience. She is truly the model for, she sets the standard, she sets the bar very high for how to combine research, training, advocacy. She does it all. She's completely dedicated to health disparities and particularly cancer disparities. She has, as you see from the very long bio that we sent you, she has just an incredible array of experiences and accolades. And so I'm not going to go into all that. I just am thrilled that we can bring Lourdes to you, and feel free to spread the word about the availability of this webinar on our archive. Those of you who are present today have the opportunity to see it live and ask your questions, but it will live on for a very long time and be a benefit to a great many more people. And so I just, from the bottom of my heart, Lourdes, I thank you for carving out the time today when she's not only doing all her usual stuff, but she's added on all this work around COVID. And, you know, she just has endless commitment. I hope she also has endless energy and life. So without any more of me chattering, welcome, Lourdes, and please take it away.
Thank you. Thank you, Rena, Danny, and Stacy, for all of your kind words and the opportunity to speak to some of my favorite people in the MTPCCR alumni group, as well as others that might be joining us. And thank you to Dr. Amelie Ramirez as well for inviting me to do this webinar. Today, I want to talk about the role of CBPR in reducing health disparities and some of the challenges and opportunities, and really focus on an example from the coronavirus pandemic. And as you well know, it takes a village. So although it's my name that's on this presentation, but really it's been the work of an incredible team and a lot of people. So, you know, they say it takes a village, it takes multiple villages, I think, in this time to do the things that we want to do. And I think I work with amazing investigators and other and clinicians at USC, as well as my team, who are really superb to make things happen. Next. So from the USC Norris Comprehensive Cancer Center, where I'm the Associate Director for our COE, or our Community Outreach and Engagement Office. We have been working with these principles that really help to drive a lot of the research that is done in conjunction with our communities. And we utilized or try to always have both qualitative and quantitative aspects in the work that we do in CBPR, and so that it is based either on data from the cancer surveillance program, data from environmental scans and needs assessments, or actual data that's being collected at the time that our programs are out in the community as well, so that we could have that as a background in an evidence-based type of interventions that we may do utilizing community-based participatory methods. We have our NCC members provide research, training, education, outreach, capacity building, and the technology, while our communities are engaged in needs assessments, cultural competence, as well as community competence of our investigators, dissemination of information, education, advocacy, and policy. And the goal really is to reduce the disease burden in our catchment area, which is all of Los Angeles. And so you can imagine servicing over 10 million people. And certainly a lot of those folks are Hispanics, but we also have we have the 7th largest concentration of African Americans in the entire country. And we have the largest number of Koreans outside of the Korean Peninsula. So today I'm going to report about some of our work with Latino populations, but always like to acknowledge the incredible diversity that we experience in Los Angeles. Next. So when we talk about our community-based participatory research, we are guided by a series of principles. And I want to say that there is a distinction between conducting community-based participatory research per se, conducting community-based research overall, and also trying to incorporate participatory research principles in the work that you do. And you could do all three at different points in time, because not all projects will necessarily lend themselves to a community-based participatory research model in its purity. However, the types of principles that guide this can always guide your research, no matter what type of research you're actually conducting. So one of them is to engage the community partners from the beginning stages or conceptualization of the ideas all the way to the dissemination. Oh, and I do want to acknowledge these are not my principles. They were coined by Barbara Israel in 1998, but they are what we use for a lot of our studies. Working with the principle of shared equity and decision making, engaging in mutual learning, negotiating common vision and goal, compensating the community. I think this is a really key piece, because a lot of times we engage the communities, but you need to show in your budgets a reflection of that engagement and how much money is going to the community based on the research that you're doing. A lot of times our community partners, we let them be the ones to obtain the grant, even if we support the writing of the grant. So that way they have the ability to control all the funds, and we're just a subcontractor on it. Other times we are the major contractor, and they come in either as a subcontractor or as an equal partner with us on the work, and it's shown through the hiring of staff from the local community and other aspects. Next. So many of you have known about our Tamale Lesson or our Tiempo campaign. And both of these campaigns really help to inform the work that we're doing in the pandemic. We're very much continuing our engagement in those aspects and areas that we're now engaging in with virtual reality when the pandemic hit. And, we had to pivot rather suddenly in order to be able to address the huge and enormous needs that were arising in the community. But a lot of what we did was what we had learned from these two signature programs. For the example, with the Tamale Lesson, we were able to really reduce the disparity within 6 months. and that disparity was in cervical cancer screening. And we were able to develop this film called Tamale Lesson that some of you have seen, and you can go to Tamale Lesson USC. If you just use Tamale Lesson, you'll get recipes, but if you do USC, then you'll get the video. And there's a 3-minute clip which uses this image of a chicken. And it's kind of funny and people really enjoy it. But the key thing is that within 6 months that people view that film, we were able to eliminate a disparity that existed at baseline in terms of cervical cancer screening in the community. With the Tiempo campaign, which is a campaign that uses the blooming of the jacaranda tree when it's in bloom in Los Angeles, especially between the months of April through June. And we've been putting out this campaign for 4 years, except now in the pandemic year, we did not put it out because people were not going in for other kinds of things. Except COVID. And this is part of the staff that worked on the Tiempo campaign, and some of them still work on it. And what we learned from that campaign was about the need for visual imagery, as well as the engagement of promotores de salud, which we've always had as part of our projects, but it became even more important to engage the promotores de salud at that level. Next. So I'm talking about how we had to pivot, but we utilized all of this information for the development of this project, which we call Stay Connected LA, which is a project where art meets public health. And I want to acknowledge my co-PI, Dr. Kayla de la Hague, as well as other investigators, Dr. Tess Cruz and James Steinberg and Bonnie Olson, who have been major investigators working with me on this project. And it's a project really aimed at the surrounding East area community of Los Angeles, which includes Boyle Heights, Lincoln Heights, El Sereno, and other adjacent areas. And this project in particular, informed by Tamale Lesson and by Tiempo, is a community-driven project which has many of the elements of CBPR to produce a culturally tailored multimedia and multi-component educational campaign on COVID-19 as an intervention, and working with Latino artists in the community to do so. It also has other components like a promotores de salud component going pretty much more one-on-one and through Zoom, small Zoom meetings as well. And the goal is to increase vaccinations, as well as to really increase knowledge and the use of health safety behaviors, including mask wearing, social distancing, etc. And also to look at issues of social connectedness and how people were or not connected to the proper resources in the community, and any mental health issues that could be identified in order to make the proper referrals. Next. So we engaged our community partners. This is a map of many of our partners and the location of our partners. So we have about 99 partners, of which 37 are very active partners, and the others we tend to maintain relationships with and provide information. But as you can see in the center square, that's the area that we're focusing on. And in this case, we worked with the arts community, the Promotores Networks, and Clínicas Monseñor Oscar Romero for the development of this project in particular. Next. Next.
Yeah, it's not, hold on, sorry.
It's just slow, okay.
Yeah. Not moving. Let me exit out really quick and try to.
So, it's really important to maintain relationships with your partners in general ways, because even if you're not at the moment doing a particular project with them, it's good to have those relationships established over time, and for you to be going back and forth within those communities in order to make sure that those relationships are strong at the community level and that they're maintained as time goes on. So among our partners, as I mentioned, we have Proyecto Pastoral and Clínicas Monseñor Oscar Romero, which have promotoras de salud components And they are very, very much engaged. And these are women and men that have really won the trust of the community, and they serve as really some of the foot soldiers in the community in order to engage community at a very intimate level in the work that we do. Next. So Stay Connected LA, again, it's a project where art meets public health, and it has some qualitative aspects and some quantitative aspects. So in the quantitative aspects of the project, we utilize data from the Understanding America survey. We're also conducting our own survey, and also really getting data from participants at different levels. In the qualitative aspects, we have a community advisory committee that's very, very engaged, including composed not just of stakeholders in the community, but also the arts community and artists from the community that come to our meetings every other month. We also have held town hall meetings in order to get a very clear picture from the community residents themselves as to the areas that we should be focusing on and what they will accept or not in terms of what they think is effective. We've been running focus groups and really engaging the community in decision-making of the project in many, many aspects of it. Next. So here's a little bit of data on coronavirus in LA County. And unfortunately, this has not changed much, although the cases have continued to rise. But what we're seeing is that the LA County population is composed of 10 million people, of which about 49% of them are Hispanics. But what you see is that in terms of the number of cases represented in LA County, the Latino population represents 62% of the cases. And in terms of COVID deaths, almost 52%. So you could see that this has been really a difficult pandemic for our communities. Next. So the quantitative aspects of our data are coming in part from a national and local panel of participants that has been out of the USC Dornsife Center for Economic and Social Research. And my co-PI on the program, Dr. Kayla de la Hague, is a member and has done a lot of work with this survey. And so the survey is in a sample of 1,800 adults, of which 40% are Hispanic and Latino. And it's being collected right within our catchment area. Next. You could skip that. Next. So what we see is that as of January 6th, about 60 to 65% of Latinos said that they would get the coronavirus vaccine. However, what we've noticed is that over time, these percentages are actually getting lower, and that this still leaves a large segment of our population, 35 to 40%, that were not too keen on getting the vaccine. And this is just January data. Next. So, when we asked how likely they were to get vaccinated for coronavirus, once the vaccine was available, and this is in all different groups, as you could see from this, only 32% of African Americans, 37% of Latinos versus 49% in the general population said they were very likely to get it. And so you see the vaccine hesitancy in the lower levels here of this graph. Next. We also asked some about, about beliefs related to the vaccine, such as if the vaccine was considered useful and effective, and how important it was to their health. And again, we see African Americans and Hispanic Latinos having lower numbers of endorsing those kinds of items than the general population. Next. These are more specifically to behaviors to see how useful the vaccine was considered. And what we see again is the same kind of trend, and especially a worrisome trend is that among the 65-year-old and over, those numbers were higher than in some other groups. Next. We also saw in the data an increase in social activities, such that people were receiving more people at home, gathering with people that were in 10 or over, in groups of 10 or over, and saying that now they thought visiting relatives at home was safe, and even if they had not been vaccinated. Next. And I think that picks up a little bit of the, what we're calling the COVID fatigue. So they had visitors in their homes and also were attending gatherings of more than 10, and this trend had shifted from earlier on. Next. Why don't we jump that one as well? But that one is really just looking at public transportation and the use of transportation. So to there, that's where we have really compiled data from the community, trying to understand what's going on in the community. And then this aspect is the more qualitative aspect of the data, where we've had our community advisory committee weigh in on the data. We've also had our town hall meetings and focus groups that have really provided us with this kind of information. And you see that there is some enthusiasm and some hesitancy. We see both in the community, and really looking for role models in their families that would get the vaccine, because they felt that if trusted people in the community got the vaccinated, then others would. They say things like, if I get the flu vaccine every year, so it's sort of like that. But there is still some skepticism around the coronavirus vaccine. Next. We learned from the community that really it has to be easy for them to be able to get the vaccine and facilitate it. And it all has to do with the trust that they have in the community. Next. And we're also hearing that it's that, they were very concerned about parents and elders who are in isolation, like prisoners, and that many of the family members were traveling still to and from work every day and didn't necessarily have the ability to stay home and to really protect themselves. And that it was really hard to social distance, especially for people who work in restaurants and stores serving the public. Next. We also learned that they were very concerned about their children. The family was a really central piece. In one of the focus groups, somebody recited a poem of the kind of messaging that we should be getting out to our communities. You are my other me. If I do harm to you, I do harm to myself. If I love and respect you, I love and respect myself. And one of our advisory committee members recited this poem during one of our community advisory committee meetings to really showcase the kind of messaging that they thought was important in our community. Next. I'm going to skip that because I think I've already dealt with some of that, but the general issues dealt with, the concerns over personal information. They wanted us to produce multi-generational messaging and really address how people were coping emotionally with the pandemic and about the family and staying together as a family. Next. They said our audiences should really be the workers, multi-generational type of things. Also making sure that we address issues of large immigrant groups, and to think about multiple ways of accessing or delivering information, anywhere from local churches, which we've done in the past, to social media, and really going to a laundromat or a supermarket, which are the places where people are. Next. I'll skip that. So I want to show you, this is the imagery that was, this is hot off the press. We just had the last focus group this weekend. And pretty much we did a call for artists to submit to us multiple concepts that they thought would be in the community that were all based on the qualitative data and the quantitative data. And we held meetings where we reported this information to the artist. And remember that all through this, the arts community, arts organizations have been participating with us on a weekly basis, some of them really engage with us in this project in all aspects of the project. So we ended up with 11 submissions from the community, anywhere ranging from theater to the spoken word, all the way to dance type of things, all the way to the more visual kind of messaging and imagery. And you know, the program called itself mostly for this visual imagery and messaging, which would be going out in a mass media campaign to the community using both social media as well as the regular outdoor outlets. And so what we see here, these are two concepts from the same artist, and people really love these. The one on the right, after it was focus group tested, they wanted to see changes. They wanted us to add a figure that was like an elderly figure as well, and to make sure that everybody was wearing masks. On the left-hand corner, it's a mural within a mural. So what you see is a mural in the background, which has anywhere from Cesar Chavez to skeletons with Day of the Dead, to iconic areas that are very recognized in the eastern part of Los Angeles. And then you have the mother who is with the child getting the vaccine. And they suggested changes on this one as well. For example, in line, they would like to see an elderly person standing in line, as well as potentially a disabled person that's standing in line, and to make even more clear the landmarks that are in the back that are recognizable in the east area of Los Angeles. And then the message, vaccinate for yourself, your family, and your community. You know, issues of postponing life to preserve life, posponer la vida para preservar la vida. So you have to postpone some of the things you do today, but you know, that means that you could live a longer life with all of your family together. One interesting thing which really caught me, which varied from tamale lesson, when we did tamale lesson, our promotoras de salud and community people through focus group really much told us that they didn't really want one more sad story, and they did not want, you know, they wanted something funny, and that's why we ended up with the chicken. However, when we asked about the tone, the tone here was very serious. They said, we've seen a lot of deaths and we've seen a lot of sick people, and this needs to be taken very, very seriously. And so going with a comedic approach somehow was not, you know, the way to do it with this messaging. And, you know, if we would have only taken data that we had from before from Somali lesson, which said that they wanted to hear more, you know, comic type of information, this would not have been the way to go with this. And so what that is the value of testing these things with the community, and the community through the town halls was been really important, because they're the ones that are going to have this visuals in their communities. And so we also need to make sure that those visuals would be accepted by those communities. Next. So what are some of the opportunities with CBPR? So what we've learned through not just this project that I wanted to present to you today, but previous projects that we've been working on, is that really ensures that some of the topics come from the community. So even though we had a general topic about COVID, we didn't know at the beginning of the program exactly what was the direction that it was going to take and what was the messaging that it was going to turn out to be. And that was provided by the participatory nature of the methodology utilized for implementing this program. Also, it enhances the relevance and the application of all the data by all those involved. So any of the epidemiologic data to all that, we provide that to the community on a regular basis. Some of our partners join the meetings just to get that information and data, even if they're not engaged actively in the project. So, we're always inviting guest speakers who are have the latest information about what's happening at the neighborhood level with COVID. It brings together partners with different skills and expertise, working anywhere from the arts community to promotores de salud and a variety of other community, folks that really give the foundation and provide the heart to the program. We have the methods and ways of doing it, and we tend to be able to secure the funds for it, but they pretty much guide the ship. It helps overcome also community distress. Like I said, we'd never go out there to implement a campaign without getting that community buy-in. And the community buy-in and participatory methods includes not just those who sit on your advisory committee, but for example, I mentioned through town hall meetings, really getting the community to buy in and to really overcome any potential distress. And ultimately, the goal is to improve health and well-being of the community. Next. But we know that, no matter how long I've been doing this, we can't always just romanticize everything is perfect and there are no challenges, because that's not a reality. We often work with competing agendas. This kind of process takes a lot of time. And so you have to be committed to a long-term relationship to the communities that you work with. You need to acknowledge that there are power issues and issues of equity, issues of identity as well, and then really have a commitment to the translation of the research into potential policies, community-based interventions, public health initiatives, public health campaigns, like the one that we embarked in our Stay Connected LA. Next. And there's also a need for continuously improving our scientific rigor. For example, planning, training, and booster programs of our promotoras is really critical in order to make sure that, we're staying on track. Being aware of any threats to confidentiality. Remember, our communities really thrive on communicating information with each other, but that could also be a violation of confidentiality within the research world. And so we're always trying to assess that. Being aware of the need to maintain that scientific rigor in order to ensure program fidelity. And we do that through periodic check-ins and making sure that we're all on track. And planning ahead, including, in budgets when we work across a large and varied geographic area, as is Los Angeles County. For this program in particular, we have a much contained area, but we're getting calls from a lot of different groups because they're very interested in what the project is doing, the information that's coming out of the project, the methodologies used for the project, and then being able to tailor these kinds of interventions to other groups, as well as to other Latino groups in other parts of the country. So just this morning, I was in a meeting with the White House COVID task force, and part of what we discussed there was how this, arts and public health program can be implemented as American community, as well as in some of the Asian Pacific Islander communities as well, and engaging those communities and those groups, in addition to Latino artists all over the United States. We have areas around the United States that are very rich in terms of the culture, especially Latino culture, and that have, areas where the arts community is really key and important and really gets at the heart of, our different needs in the community, especially at this time. And one last thing is that we've also engaged the faith community. And part of the engagement of the faith community has been not just the engagement of pastors and others at that level, which has also been very important, but really trying to understand the spiritual aspects of this disease and the deaths that have happened in our community, and trying to make sure that the messaging that goes out still provides some hope and lifts us in a more spiritual way. I think that's the last one. Next. I think that was my last one anyway. So with that, I'm happy to answer. Oh, there we go. Okay, so some of the lessons learned. This is really a partnership. It involves give and take. The essence and mission of community research needs to stay in context. So I'm now open for questions and happy to respond to any questions or comments or anything that you might have.
Yeah, and if
And
anyone
thank
wants
you.
to type them in the chat box, just go ahead and type them there, and I'll go ahead and ask them. So feel free to type in your questions.
Can you hear me? I would like to ask a question.
Yes, of course.
Lourdes, that was fabulous. Such a lot of information to digest, and really exciting work. And I have two questions, actually. One from 30,000 feet and another much more detailed. So the 30,000 feet one is, I've been really fascinated by how people in our field, not just the community-based researchers and interventionists, but people more broadly involved in disparities, have tried to pivot to COVID. And I've been really impressed across all disciplines, really, by the basic sciences, the clinical setting. Everybody was like a school of fish, swimming in one direction and suddenly turning in another direction. And I've never thought of us as being that flexible and agile. But a lot of people have done it, but other people want to do it, and they don't have that pre-existing base in the community or experience in the community. And so I'm not completely sure what my question is, except to say that do you have any insights to that? Were you surprised yourself that you were able to do this? Have you seen others struggle trying to do it? How can we be better prepared for the next time? Because there sure will be a next time in one form or another. So that's my 30,000 foot question. And the more detailed one is, I was fascinated by your slides about intention to get the vaccine, because in my research in cancer screening, we found that the construct of intention is sort of a white person's construct. And in fact, it only predicted behavior change in Anglos in a study of 5 race and ethnic and 4 language groups. So are you going to be able to see if the same cohort did get the vaccine, or who among that cohort actually did get the vaccine? I think that would be really interesting. Long-winded, sorry.
To answer your first question, I'm part also of a pandemic research center that was created through the Center for Environmental Health and the Department of Preventive Medicine at USC. And that center really supported us in sort of helping us pivot. And so if you're able to engage and involve in ongoing efforts that are, within your academic institution or other institutions, which there are many at this point, not to necessarily have to reinvent the wheel, but for you to then become part of that. And that it would be the best way to go, because there's already been a lot that is being done. When this first started, I think I was running around, trying to figure out what we needed to do. what we needed to do, even with our cancer patients in particular, for example. And the only thing that we thought of is go to our partners, go to immediately to our communities and talk to them and ask them. And we realized at that point that one of the needs was for PPE. So it wasn't research or anything like that. They just wanted protective equipment. So immediately working with Dr. Karen Lerman and some of our donors, we put into action a series of mini grants awards and just put money out in the community to get people to get PPE. Once the immediate Russian need was a little bit satisfied, then they were able to come around a table and talk about what they were seeing. We met with them regularly to really understand what they were seeing in the community, because you know, those with cancer or any other chronic conditions are even much more vulnerable in this kind of situation. And so that was a major concern. So by embedding ourselves within existing networks or folks that had already pivoted towards this pandemic area, really helped to support the work that we did. And then utilizing all the lessons we had learned up to that date in our other research to bring it in. In terms of your second question, one aspect that I didn't talk about here is that we are also, as part of this program, engaged in getting people to the vaccine sites, working with the promotores de salud and working with our community partners. So just last weekend, we held the first event at Keck Medicine where we vaccinated 500 Latino elderly from the immediate area. Which are part of our population that is also being surveyed. And so in that sense, we were able to do that and get them in. And the complexities of doing that are mind-boggling in the sense that, you know, it's not just making an appointment for a person to be able to access the vaccination, but also being able to confirm the appointment with that person who may not have an email or who may not have a telephone that you could use in the same way, you know, like a cell phone or a text messaging. So all that became a real challenge. And that's where our promotores de salud really came in and stepped in, and even getting transportation out in order to facilitate not vaccine hesitancy per se, but the vaccine hesitancy that comes because of the logistics of implementation. And so, yes, we're able to follow up with these groups. This coming week, we have about 700 that we are now in the process of finalizing signing up, and we will offer another major vaccine vaccination in the community. So yes, we're able to follow that and be able to understand who got vaccinated and who didn't, because we have the records and we're allowed to look at that aspect of their medical records.
Wonderful, wonderful. Thank you. What amazing work.
Any other comments?
Dr. Hughes, do you have any questions? Nothing's come
Yes,
through.
I did have a question. Lourdes, you know, again, I'll echo Rena's comments. Fantastic. Give us so much to work with. What a job. I've got to ask you though, how important do you think the cultural congruence between the community and those that are seeking to conduct the research, how important is that?
That's critical. That's really critical because of the trust. And this is an issue that, remember, not everybody is trusting this vaccine. Not everybody is on board with this vaccine, anywhere from even our medical providers. And I apologize because there's a sound coming from somebody's lawnmower, not mine, but I think you might be able to hear it. So the thing is that, you know, having people from the community that are part of that community, being able to work in that community, investigators in the community, you know, like myself and others that are really out there in the community and happen on a regular basis, really are required now to be able to build and solidify that trust. We have had people come in just this weekend who said, you know, I wouldn't have come in if it wouldn't have been for you, because I know you, not me in particular, but Rosa Barona, who's one of my project managers, who's amazing. And she literally got in her car. There was this lady who having problems. She missed the bus. Rosa got in her car and went and picked her up and brought her to get the vaccine. So what I'm saying is like, having people who are just like you and people that, you trust is really what's needed now. And that's really key. I think that that's key at every single level, even in the people providing you with the accurate information about what their hesitancy is about.
So as a follow-up to that, if you're a researcher and your name is John Wasp, non-Hispanic white, and you have a burning desire to do the research in an African American community, how would you advise them to do it? Form a focus group, seek out the key gatekeepers, or how would you approach it?
I would start with having them really engage with ongoing coalitions. There are many coalitions. For example, in South Los Angeles, we have CRESLA, which is a coalition of African American organizations. And so I've been part of CRESLA for many years and just recently received the CRESLA COVID Leadership Award, which is from an African American group. But that's because you're building the relationship through them and you let them guide you in terms of when, what, and where, and what, and how, and whom. And so you pretty much work with that organization, a champion, a leader in that organization, rather than you being the one completely out there saying, I'm going to be the savior, I can do this. Well, no, you can't, not in these communities. And that's where you need to have community competence in addition to just cultural competence, where you really understand the community and how that community works.
Fantastic. Thank you so much.
So just to
That's
piggy off.
such a great question, Danny. I hear it all the time because I'm just a plain vanilla white person, and I have been able to work really closely with the African American community, but that was after years of really supporting and listening and learning. And I discourage people, if I don't think they have the sensibilities to do that, because that is what it takes. And that's the whole basis for Exito and MTPCCR, that we need leaders from within the community, like Lourdes, like Danny, like Amelie, to do this work. That's really, and we're getting them, and it's changing now. You do see all the time on TV these outstanding people of color in leadership roles, and you're never going to go backwards on that. You can't stuff that genie back in the bottle. And those leaders will beget more leaders from among their communities. And that's how change will really happen.
Well said.
Sorry, I just get very excited on that topic.
We also do need champions, people like Rena and others, which are in places that sometimes we're not in yet. And so we need them to be able to open the door for us as well, like, the MTCPR program does, and folks like Rena and Marjorie Kagawa-Singer and Amelie and others, and Danny on this call, because, we have to be also open to, getting into these areas that we've never been in before. And sometimes only the white community and males may still be in that, like I work in a very medical center where there's still a lot of that kind of, infrastructure. It's changing dramatically, but there's still, the diversity is not at the level that we would like to have it there. And so we also do need champions in other communities to open the door for us and to walk with us the journey.
Well said. Thank you all very much.
Lourdes, you started doing this way back when to say that you were likely the only, it's so hard. What advice would you give to younger people now who want to follow in your footsteps?
be stubborn. My family says I'm just so stubborn. And that I won't see, it's like if you give me a challenge, you give me, a challenge, that's like, okay, I'm going to thrive on that because I'm going to resolve that. And so sometimes it just takes perseverance and never giving up, just keep going. And the passion that you derive from working in the community and the drive, I mean, because people ask me like, why are you still doing this so many years later? And it's like, that feeds me emotionally, spiritually, at every way. And so being perseverant, being respectful of the communities around you, being open to learning, to listening, all of those are really things that make a difference. My career has been studying human behavior and being able to understand how that behavior shapes or not our decisions to make us healthier, and whether that's in cancer and any other area. But the perseverance, I think, is really key. And knowing that, you're going to be hit. You're going to be really hit. There was a time that I thought was a very low time when we were facing some of the recent issues with the Black Lives movement and the recognition of many others in the community that these things had been happening for years. And that was a depressing moment, to think that, these things were still happening in our communities at this level. And then, then how uplifting that became when all of these communities stood together, to really fight racism and discrimination. And that was so inspirational. So stay in the fight. It just, is part of what we do, and it's important what we're doing. And to do your work, not just to get acknowledged and published in a journal, which is also important to get your career advanced, but also because you're going to make a change and a difference in the community. And that has its own rewards that are incomparable to anything else.
So we do have a few more questions. One of the questions asked from Sarah Tran, since LA County contains the largest Korean American population, do you have any data on their perception of the COVID-19 vaccine?
Yeah, so we're starting to get some of that data through the Understanding America study. I don't have that data with me, but one of the things that we are seeing is a certain level of distress as well overall in the community. So what we have done is really trying to work with several of the religious organizations in that area, as well as work with the textile community in that area, because and sort of the digital types of folks working in that area in the business community to try to have better understanding of what's going on. We have run focus groups with Korean Americans to try to understand what needs to be some of our outreach strategies. But we don't have funding right now for programs that are specific to the Korean community, except for one potential program that we may be starting through the Lazarus Foundation that will focus also on Korean Americans and the creation of wellness hubs throughout all of Los Angeles for this African American and Latino communities. So yes, we're starting to see that. We also see that there's a lot of discrimination in the Asian community, people discriminating against Asian people, not just Koreans, but a lot of people don't distinguish if they're Korean, Chinese, or from another community. And, there's the last 4 years, we heard a lot about the blaming of that community because of the origin of the virus. And so there are serious issues happening in that community. And some of my colleagues are also working on that as well. I'm working less in that area, but we do have access to some of that information and efforts.
Okay. Sarah also asked, what tips do you have for a student like her who primarily works with secondary data to incorporate CBPR principles into her dissertation work?
Oh, so she's working with secondary data for that. What I would say is that you may want to take your findings and hold a couple of focus groups with your findings with community folks to really get community validity, so that the community validates those findings. They could be statistically significant but be meaningless in the community. So to get that community validity, you may want to run a couple of focus groups or run by a community advisory group or something like that that might already exist and that you could tap into, or create your own focus groups in order to present your data findings and see what they mean for that community and how to best interpret those findings in light of the context that people live in that community.
Okay. And one more question. Can you elaborate on the role of promotoras from
Oh,
the
sure,
lake?
that's one of my favorite subjects. I'm totally in love with the promotoras model. Just yesterday, I was talking with Maria Lemus, who is the founder and director of the Visión y Compromiso, which is the largest network of promotores de salud. And she was telling me about how they've gone completely national and are going international now with their model. So the promotores de salud model, and there's been several Latino investigators like Hector Balcázar and others who have done some research on this as well, is incredibly effective. That model is so effective that now it's being implemented in other communities as well, so that these similar concepts and similar training are being used not just with Latinos, but the promotores de salud are trusted individuals who come from the community, who have lived in the community, and really have the pulse of the community and have the trust of that community. And we do trainings anywhere from IRB training to train the promotores de salud to be able to do the research and be engaged in not just recruitment, but actually implementing the research out into the community or implementing the interventions, as well as holding, some of the meetings with those different community groups. Our promotoras were essential in helping us with the translation when we did Tamale lesson, because we first originally did it in English, and then we wanted to translate it into Spanish, and just a dubbing and translation was not appropriate. So we needed to make sure that the concepts translated from a cultural perspective. And so some of the translation was actually changed in order to allow for that. So the promotoras can work at many, many different levels, anywhere from recruitment to providing interventions to conducting research. And it's just a matter of being able to train them, follow up with them, conduct booster trainings so they're still on track, and have someone that's working closely with them for troubleshooting. But they have been an essential part of the work that we do, and we have many programs utilizing promotores de salud, and now expanding the concept to community health workers that are utilizing similar methodologies at the community level, anywhere from American Indians to Koreans to African Americans and low SES non-Hispanic whites.
Yeah, well, thank you for expanding on that. Just so everybody's aware, we will be sharing this webinar on our Exito website, and we'll send out an email with the link to that as well as the survey. But if anyone has last comments, Dr. Pasick, Dr. Hughes.
Yeah,
Well,
go ahead,
oh,
Rena.
go ahead, Danny.
No, please go
ahead. Well, I
I'm
just
just-
want to again thank Lourdes so very much for the superb webinar. I wish her the very best with the work that she's doing, but please get some sleep as well. That's the only way you're going to be able to keep on, and we need you. We need you for a very long time to come. Thank you.
Thank you, Rena.
And Lourdes, I just wanted to echo the same comments. And to the alumni that are out there, this has been a tremendous opportunity, learning opportunity, and please take advantage of it. And also be warned that we may be asking for a follow-up survey just from me in terms of some other information I want to try to gather from you in terms of predicting success. So thank you all very much, and I'll turn it over to Stacy to close it up.
Yes, thank you so much again, Dr. Baez-Conde. We, on behalf of Exito, we just sincerely appreciate you being on here with us. I know we try to get you for months now, and we're so excited that it finally happened and it's recorded, so other people can have access to it. But thank you again.
Thank you all. Take care.
All right,
Stay safe.
y'all have a good one.
Bye.
Everybody be safe. Thank y'all.
Bye.